Hi, and welcome to whatever this channel is about. So, first off, before I get to today's topic, the headgear. It just is. Deal with it. Now, today's topic is it's about 2 years, roughly, for my anniversary of when I got diagnosed with cancer. I don't remember the exact date. It was mid January sometime. One thing I wanted to bring up was there was a few significant statistics that I was told when I first got diagnosed, and I wanted to go through those because these are the kind of information that you'd get if you have cancer. And the first one is that I had a year and a half left to live. Full stop. If I didn't have treatment. That's just the way it is. Now, I do find, and so it's important because this is 2 years after diagnosis. So I've already passed that. But then I also had treatment. I wanted to address that to begin with because I do find that as a weird statistic. Is because how do they determine? Is it like they say it's a year and a half on average from when you're diagnosed? But I first got sick, noticeably sick, 6 months prior, so I could have been diagnosed then. Or the oncologist who I saw who diagnosed me finally didn't want to actually go through the process because she'd have to test for a whole bunch of rare cancers, which is what I had. And so she actually suggested doing a wait and see. And if I had gone along with her, it could have been a couple more months, if I got diagnosed. Which does kind of fudge where the year and a half average ventures in. A counterpoint is so most traditional cancers have stages 1, 2, 3, and 4. Leukemia is not like that because there is no, and I believe the stages are because it's the size of the tumor and the aggressiveness of it. But leukemia doesn't actually have a physical tumor. It's just a proliferation of blood cells. In my case, white blood cells, ineffectual white blood cells. So my immune system was going crazy and not doing anything. And for me, there's actually three different levels: CMML 0, 1, or 2. And then the fourth level is called AML. And if you get AML, it's pretty much game over. You have weeks to months to live. So anyway, I was actually CML 1, which is the year and a half left to live. So that was the first bit of statistics I wanted to cover. So the next thing to address was the actual treatment itself. And now there are different types of leukemias. About 6 months ago, I met someone who had CLL, which I don't know what that stands for. Shoot, I can't even remember exactly what the two M's in mine stand for. But anyway, CLL, he, I don't believe, ever had chemo. And he's been living for like 13 years. I believe he does take some medicine. But the whole thing is his treatment was wait and see if it got worse. And if it got worse, then they would actually go on treatment. The most common is CML, 1M. And for that, it's chemo as a treatment with, if it gets worse, then doing the bone marrow transplant. For me, there was no option. It was bone marrow transplant or death. Plain simple. Now, the next statistic to bring up is the bone marrow transplant itself had an 80% survival rate, which sounds good because it's a high number, but also bad because that means 1 in 5 people don't survive it. The two good news is that actually it's the first 100 days after the transplant, which is a big time frame for 1 in 5 people to die in. So that's a little wiggle room because anything could happen. You could get sick, you could fall down. Oh, they always ask you every single time, when was the last time you fell? Because they just want to make sure, because if you fall, yeah, that's bad. It's a sign of things progressing worse. So they're constantly checking to see if you're a fall risk. But as you can see, it was 80% chance to survive the first 100 days. And I get it. It was a really rough treatment. And again, this is why it's not the normal go-to solution, because it is such aggressive that it does bring you close to death. And I made it through 100 days. I've actually, again, 2 years. It's actually a year and a half since treatment. My treatment's in May. I don't know why it took them like 4 months from diagnosis to treatment. That's just the way it worked out. I mean, I guess because they figured that I had a year and a half, that they could take their time. It wasn't a hurry. Anyway, the next thing I want to talk about again is 2 years. So for 2 years since treatment, not since diagnosis, I had a 40% chance of the cancer coming back. And that's one of the stats they give you at the very beginning or around the beginning. I get it because, again, it's the whole idea is they kill your bone marrow or try to kill your bone marrow, and then they give you new stem cells to regrow bone marrow. It's possible some of your old bone marrow survives, in which case it comes back. Now, all my tests I've done so far have come back negative. There's no sign of the original bone marrow. And they do it by taking a big needle and sticking it in you and sucking out your bone marrow from your hip. They've done that about 5 times in this whole process so far because they want to be thorough. And my next one is not until May. So that point I get to find out is, hey, am I really in remission or is this thing coming back? But I mean, still after 2 years, it's possible it can come back. It's just the chances are a lot lower. They just only track up to 2 years for the probability. Anything after that is noise. It's difficult to track. And then the final stat is one they gave me at the very, very beginning when I diagnosed, and that was my chance of survival. 4 or 5 years with treatment. And for my particular cancer, it was about a 35 to 50% chance survival rate. Now, because most people who get hit by my particular cancer are 20 years older than me, and because I'm relatively healthy, I mean, I am a little overweight. Okay, a lot overweight. But I am healthy. They gave me the 50% odds. So 50-50, I'd make it for 5 years. Now, I feel like I'm on the better part of that. But after this last December, getting RSV, which is basically just the common cold, and how much it kicked my ass, I can totally see why it's 50-50. Because if I was older, or if I get something like COVID, it's game over. So it's this more serious. It's hospital. I have to ICU type of thing. So, because just a common cold, something that just affects people for like less than a week, it took me out for 3 weeks. So, yeah, that's a interesting thing to live with. So hopefully my system will start getting better. My immune system is constantly ramping up. But I totally understand now these numbers and where they come from. Because again, if I was 20 years older, I would not have survived this process. And I'm relatively healthy. Some people ask is why don't they do more than 5 years? I believe Hank Green does a really great video on this. And it's basically at that point it's noise. They can't really get good numbers. Again, most people are in their 70s when they get this. And if they're going to survive to their 80s or 90s, is less likely due to other factors. Their survivability is lower anyway. So the numbers, the stats aren't really there. One thing I do say, and one of the parts of this video is I have a saying I've come up with, which is your story is your story, my story is mine. They're different, but they rhyme. And that is, each cancer again is different, but you have like these similarities of the probabilities of survival. You have the similarities of having to go through chemo, of having to just all the various little things. I can't name them all, but I did recently have an experience where I just was at a event with some friends and I was just shutting down. I was tired, but another friend who actually she's survived 5 years now from 2 cancers. Yay her. She was able to step up and speak on my behalf to be able to answer questions that people had, because even though she had it was colon cancer and lung cancer, she could still relate to my experiences and inform people of what answer their questions. So that was very much appreciated. Anyway, if you are a person who's going through cancer, just keep trucking. Just take every day at a time, and good luck. Thanks. Have a good one.